Hi, I'm Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers. IVF is often pursued by individuals and couples who experience infertility or other reproductive challenges, and there are a number of primary reasons and causes for undergoing IVF. Let's look at the main reasons. We'll begin with female factor infertility, and in that, ovulation disorders constitute a large amount of cases for which we do IVF. Conditions like polycystic ovarian syndrome or irregular ovulation can make it difficult to conceive naturally. So IVF bypasses the need for natural ovulation by retrieving the eggs directly from the ovaries, making the embryos outside the body and putting them back into the uterus. Tubal factor infertility, where blocked, damaged or missing fallopian tubes prevent sperm from reaching the egg, is also one of the causes for doing IVF. It is a very effective treatment as fertilization occurs outside the body in the laboratory by bypassing the fallopian tubes. Endometriosis is another cause. This condition causes uterine lining cells to grow outside the uterus, leading to inflammation and scarring that affects the ovaries, fallopian tubes and egg quality. IVF can improve chances of pregnancy by directly retrieving and fertilizing the egg. Male factor infertility is also one of the reasons for doing IVF, where low sperm count or poor sperm quality is dealt with. IVF with intracytoplasmic sperm injection called ICSI can overcome issues with sperm count, motility, morphology by directly injecting a single healthy sperm into an egg. Genetic disorders or structural issues where some genetic conditions like blocked vas deferens or cystic fibrosis, all these conditions are not viable for a couple to get pregnant, is when IVF is performed. IVF with ICSI or genetic testing allows healthy sperm to be used, reducing the chance of passing on certain conditions. Unexplained infertility is where standard tests show no identifiable cause of infertility, and IVF may be recommended in such cases. Declining ovarian reserve and egg quality, especially after 35 years of age in a woman, is where IVF is performed because the quality and quantity of eggs decline. IVF allows multiple eggs to be retrieved and best quality embryos to be selected, which is very beneficial for older women. Of course, genetic screening is performed where there are disorders like I said, like cystic fibrosis or sickle cell anemia. With pre-implantation genetic testing, a viable embryo which is free from all genetic conditions can be selected and put back into the uterus for better success rate. Cancer therapies like chemotherapy and radiation can impact fertility. IVF allows individuals to freeze embryos for future use. So IVF is very versatile solution for a range of fertility issues from female and male infertility to age-related concerns and genetic screening needs. It offers many individuals the chance to conceive when other fertility treatments haven't succeeded, and this makes it a very invaluable option in reproductive medicine. If you wish to know more about IVF, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.